Welcome to the Ifakara Health Institute, Bagamoyo. My name is Dr. Frederick Haraka. I'm a clinical epidemiologist. I work for Ifakara Health Institute, and my research work focuses on tuberculosis within the tuberculosis research program. Part of my work that I do includes looking at the molecular diagnostic tool known as Expert MTB RIF. This diagnostic tool was initially recommended by the WHO in 2010, and since its recommendation and rollout, it has actually been adopted by many countries, including our country, Tanzania. About 3 years ago, in 2017, I was curious to understand, with the uptake of expert across the world, do we see any impact in real life in terms of patient outcomes? It is a tool that has high accuracy, it can detect resistance, and there's a lot of expectations that this tool would also impact TB trends and therefore reduce TB globally. So I was very curious to understand, do we get any impact in terms of patient outcomes? And out of that, I developed a research question together with a team, and we were interested basically to look at the impact of this molecular diagnostic tool on patient outcomes. And we were focusing on outcomes such as mortality, time to diagnosis, time to treatment, and looking whether this diagnostic tool really reduces pre-treatment loss to follow-up, as well as other patient-related outcomes. So we set out to start doing a Cochrane review. It's a great effort. It takes a lot of time. So between 2017 and 2020, we've been working on this project. We started by publishing the protocol, and out of that, now the WHO wanted to review guidelines for use of diagnostics, rapid molecular diagnostic tools. So we were identified, and I was invited by the WHO to share the findings that we have obtained from this work. These findings were part of the reviews that contributed to the new WHO Consolidated Guidelines for Tuberculosis, Module 3, for rapid diagnostic test. And our work had evidence on patient outcomes, and if you look into this guideline, you actually see that there are quite a range of recommendations, and one of them, the recommendation number 1, is based on recommending the use of expert for initial diagnostics of TB other than other diagnostics tools, and it is recommended for all adults. Currently, we have the latest guideline that were developed last year in 2019, and so there's quite a process of how this tool should be adopted and how it should be rolled out in district and sub-district facilities. But I think the publication of this guideline provides an opportunity to the government, to the ministry, to sort of update this guideline. Because when I looked into the previous guideline, most of the recommendations were actually based on the recommendations that were published by the WHO in 2013. So we already have new recommendation in 2020. So this is an opportunity to sort of, update and review what is currently existing. So if clinicians, the general public, or whoever would like to read the recommendations or access them, I think they are welcome to access, they are welcome to read, they are publicly available in the WHO website, and anyone can actually access this.